Hello, everybody. Welcome to this interview about unexpected connections between barefoot shoes and pelvic floor health. My name is Karolina Částkova. I'm a medical doctor and lecturer of shoe sewing courses under the brand of DIY Barefoot Shoes. And I'm really glad that I can be here with Jen Bertoluzzi, a physical therapist and pelvic floor specialist. Welcome, Jen.
Thanks for having me.
Yeah, it's nice to see you like this. Even we are like thousands of miles and 6 hours away, we can still talk here, and I think this is fantastic. So,
Yeah.
Jen, can you introduce yourself? Tell us what you do.
Sure. So I'm a doctor of physical therapy. I'm an orthopedic clinical specialist and a pelvic floor therapist. So I've done extensive training in pelvic health and things like pregnancy and postpartum. And I treated orthopedics for over a decade before I started treating pelvic floor. And I've always loved treating kind of foot, ankle, and the hip connection, mostly because of my own foot issues and things that I've been through. Difficulty finding shoe wear my whole life, which is how I found your courses, and got really into kind of the barefoot movement and more like health conscious footwear.
Yeah. Oh, thank you very much. I have to say that I didn't even know that before you were doing orthopedics. So this is like great connections of both the topics. So even better. Yeah. And maybe I'm not sure if you know this, because I know that the pelvic floor issues are still a little bit of taboo, maybe not as much as it was before, but many women are shy to share their concerns, their problems. Do you know how many percent or how many women have, or not even women, but how many people have problems with their pelvic floor?
I don't know if we have great data on it. Like you said, a lot of people don't want to talk about it. And we know on average it takes someone 4 to 6 years to even bring it up to their provider, if they do at all, because those issues are somewhat taboo. But approximately 1 in 4 people have pelvic floor dysfunction, from like one research study about the United States. But I can't say for sure. I think that people assume that pelvic floor dysfunction is just like leaking urine, and there's a lot more that goes into it. So I treat things like back and hip pain that can have a pelvic floor concern, things like bowels, so constipation or straining to go to the bathroom. Obviously the urinary issues, whether it's actually leaking urine or what we call urgency or frequency, just feeling like you have to go to the bathroom all the time, or rushing to the bathroom and being afraid you're not going to make it on time. So there's a lot more that goes into it. And then obviously, the time that people do think about it is pregnancy and postpartum. So at least that is becoming a little bit more mainstream, but there's a lot of other things that kind of fall under pelvic health that, people might not know about.
Yeah, it's great to know that even, for example, my back pain can be like connected with the pelvic floor status or pelvic floor health. And I have 4 children myself, so I really see some changes of how my body works and how my pelvic floor works. And what can I do about it myself when I notice that the things are not as perfect as they were before? What can I do myself?
That's a really hard question because everyone has a bit of a different experience when it comes to pregnancy and postpartum. There are certain very specific changes that happen. I'm going to grab my little pelvic model here. So for when we are pregnant, this pubic symphysis in the front tends to widen. The joints in the back here need to spread as well to open kind of the outlet for that baby to come through. But there's postural changes that happen with the center of gravity from, the belly being out in front, the way we tend to lean back more. And then our lower abdominals tend to get overstretched, right? Because that's where baby is growing. And when they're sitting low, they're putting more pressure on that abdominal wall. So, core strength is always important, and hip strength is really important because the hips are the things that support the pelvis, right? And there are muscles that attach from the hips onto the pelvic floor and influence how the pelvic floor functions. So it's important to work on those kind of strengthening things. But if you are having trouble or dysfunction, or if you're not sure if you're doing something right, to get an assessment, because one exercise might be good for someone and not great for another one, and that just might be how they're performing the exercise.
Oh yeah, so it's not only that I will do Kegels and everything will go like back. Yeah, it's not like this. Okay, so when should I think about searching help?
So if you do have any issues in terms of like the bowel and bladder things that we talked about, if you are difficulty with intercourse is another one that comes up a lot, and especially that's big postpartum. If you have scars or scar tissue, either abdominally or vaginally, I would say sooner rather than later. It's just good to talk to your provider about. And truthfully, a lot of providers, whether that's a primary care, a midwife, they don't really know the scope of what we do. So a lot of times the people that are getting referred to me are people who found out about pelvic floor therapy kind of on the internet or through a friend that has done it and said, this was a game changer, you should do it. And then they kind of ask their provider. But certainly if you are, having some of those hallmark symptoms in terms of like pain with sitting, leaking urine, feeling like you have to pee all the time, or having a small bladder, discomfort with intercourse, bowel issues, whether it's leaking gas or feeling constipated, like it's hard to poop or painful to poop. I mean, those are all pretty big symptoms of pelvic floor dysfunction and probably should not be ignored.
Okay, so thank you very much. Yeah, it's great to know that it's not only leaking urine or things like this, but there's much more that can be connected with the pelvic floor. And I'm really interested. I know because this is our main topic, but can you tell to the people that are watching us, does footwear affect the pelvic floor health?
Yes, I think so.
Okay, can you tell us more about it?
So there's a lot of different, so again, I treated orthopedics for over a decade before I started down the pelvic floor training. And there's just some connections that we know. So the pelvic floor muscles are innervated by spinal segments, S2, S3, S4, and so is the foot. They also have innervation or feeding from the lumbar spine as well, but those things are connected. And then you can look at fascial lines in the body and how we transfer force. There's big connections between the big toe, the foot, hip, pelvic floor. And then kind of functionally. So when I am treating someone for pelvic floor dysfunction, if say they're having trouble with like leaking with running, we need to look at their running mechanics. What is their foot doing? Do they have enough toe spread? Do they have enough shock absorption through that foot to transmit that load to not get overburdened at the pelvic floor? So I think a lot of people think that pelvic floor therapy only treats the pelvic floor, but really I treat everything that affects the pelvic floor. So for me, that's core, hips, and feet are a big one because our shock absorption is through our feet. So if I'm wearing a shoe with a really big heel and I have a really hard heel strike, again, a lot of that force gets transmitted up, knee, hip, and pelvic floor, has to work a lot harder. So if I can put someone in more of a zero drop shoe or just have them walk barefoot, they don't often have as hard of a heel strike. They tend to land a little bit more softly. And then you can start training some of those patterns and see, does that make a change at what's happening at their pelvic floor?
Okay, so that's really interesting, and I know that you are that you wear barefoot shoes, and you maybe recommend to your clients wearing barefoot shoes. And can you tell us specifically how barefoot shoes can affect not just pelvic floor, but maybe like overall health, or maybe more the pelvic floor, how they affect it?
I'll do my best. But I look a lot, when I have someone who's having either just general hip pain, back pain, foot pain, or whatever, I always look at the wear pattern on the bottom of their shoe, because that tells a lot about how they walk. And again, then that leads me to figure out where those forces are being transmitted and where we need to work. So if someone has a lot of wear kind of like at the base of the shoe here and not further up, then they're landing really hard here. Some people you'll notice only wear on the outside of their shoe or just right here in the middle, and that tells me that they're spinning. a lot through their forefoot when they walk, as opposed to pushing off through their big toe the way that they're supposed to. So, think about how many thousands of steps you take every day, right? If I'm landing really hard or not absorbing shock well because maybe I have a really rigid midfoot, those things have implications up the chain in the pelvic floor and the hip. So putting them in a shoe that has more zero drop makes them more aware of how they're landing. And then especially the toe box is really important, because we know there's big connections between the big toe and balance and our pelvic floor. So our pelvic floor is much more of a feed forward muscle. It's an anticipatory muscle and a reactive muscle. And we get a lot of that information from the foot, right? So if I can't feel what my big foot is doing, or my toes don't have good grip into the ground because I have enough room in my shoe for them, then that negatively affects the signals that are getting transmitted, and more load has to be taken kind of from up the chain. So if we can get someone in a shoe that allows that natural toe splay and grip and proprioception, that feeling of balance, and they can give better information to the brain, and ultimately our brain can kind of organize the system in a better, more efficient way.
Wow. Oh, thank you. This was really great. And I really wanted to have a look at the bottom of my shoe. Yeah. But
look at the bottom of your shoe.
And maybe this is an easy thing that everybody can do, and it's great, and it tells a lot. And I always have my heel area more worn than the other areas. Even though I walk barefoot or in barefoot shoes for years, I still step very, very hardly on my heels. Yeah, so it's great to know. And yeah, this is
and
something
we all do. Yeah. That's okay, right? It's just, if that's, you can look at it like side to side. If someone wears really hard on one heel but not the other, right? They might be landing harder on that side for a reason. It is very normal for us to all have a bit of a heel strike. It's just, think about how big our heel bone is, right? It's massive, and it can take a lot of load, but we then need to distribute it throughout the rest of the foot. So I don't want you to think just because you have a little bit of a heel strike that that's a bad thing.
Oh yeah, I have it quite a lot, so maybe something to think about, because this is the reason why I have to change the sole of my shoes quite often. So, so maybe something to think about. Okay, great. And can you show us, or can you tell us about your shoemaking journey, and maybe show us the shoes you made yourself, and tell us, why did you choose custom-made barefoot shoes?
So I think my personal opinion is that everyone can benefit from more of a zero drop. So the same heel width and the same toe width or height of the shoe, and a wide toe box. The variables that I play with are cushion and arch support. There are some people who have structural needs for arch support, and that's okay. Same thing with cushion. If someone's like, I used to work in a hospital, and being on hospital cement floors all day, you might need a little bit extra cushion, and that's okay. But I think the two variables I'm not really willing to give on are the zero drop and the wide toe box. So for me, I have a wide midfoot. So the area around my pinky toe often is what gets smushed in shoes. And I've never really been able to find shoes wide enough. And custom shoes are very expensive. So I like to craft. And I thought, let me see if I can figure this out myself. So here's my boot that I made. This was the first one. So you can see that it has that really kind of square. I have a more prominent big toe, and I have a bit of what are called like bean-shaped feet when I'm standing. So they kind of want to rotate that way a little bit. But this was the first course that I did with you, and made these boots. And I learned a lot about how I stand versus how I walk. So when I stand with my arch much higher, and my toes kind of go into that bean shape a little bit more. But it's not so much when I walk. So the second course that I did was the lace-up shoe, and these actually had a different topper on them. I made a slide-in first, and then I ended up not liking that. So I, was able to undo the stitching, take the top off, and make a new top. So it's now more of a lace-up. And these are kind of my everyday shoes that I get a lot of compliments on, by the way. So thank you. Okay. And then I also did the sandal course. So these were my sandals that I made. And again, you can see kind of similar shape because they're all my foot shape, which I think is really wonderful, but I don't have to compromise, on this segment of the shoe for me. And because these I mostly just wear in my neighborhood on cement sidewalks, I did add, I don't know if you'll be able to see it, but I did add a couple millimeter EVA foam for a bit of cushion, just being on that hard concrete. So.
Yes. This is also great about making your shoes that you can really use more cushion if you need to for every type of the shoes you make yourself. So you can put a layer more. Yeah, you can put an insole, for example, if it's still not enough. So you can play with it. Okay. And do you have any suggestions for the people that are thinking about making their shoes? How should they start? What should they do first? Or I don't know, maybe if you want to tell us something about this.
There are, there's tutorials online, but I think really the feedback is really helpful. So I think that's why I went towards your course instead of just following, a paper instruction, because a lot gets lost in translation and you can learn from people who have done it before. So for me, that was really helpful, being in the Facebook group with you and getting some feedback on like my drawings, or, if something wasn't seeming to add up right, how we could troubleshoot it, was really helpful to make the end product, what I wanted. I would say if someone is considering it, to maybe start with the sandal course. I feel like that requires the least amount of like tools and resources, but you can learn a lot again about your foot shape and kind of make an entry pair. So if things weren't quite right, then it's easier to figure that out for when you're putting more effort into the boot or the shoe, that you kind of already have figured out what you like, your measurements, how tight you like the shoe or not. Yeah, does that answer your question? I'm sorry, I got a little sidetracked there.
Yes, I think you did. So I agree that the sandals are maybe the easiest type of shoes you can make. It's not much sewing; it's more like gluing work. But yes, exactly as you said, it's great for the start, and great even for for the season of the year, because we have spring here, and today is the first day I'm wearing sandals because we have like 20 degrees here, so it's like really cool hot weather. So it's spring, but almost summer weather, and for me this is enough to wear sandals. So maybe great time of the year to start with these. But you started with the lace-up shoes. Do you think it was like difficult for you as a beginner to start with the lace-up shoes?
I don't think it was too difficult. I like to sew, so I have some experience with pattern making, and I made kind of like, I don't know, you probably don't remember, but I made a template out of like a fake leather that I had, just some scrap material, and kind of tried it on to sew it and to see if that worked first before I cut into my leather, because I was very nervous about cutting into my leather. But things that I learned after the fact of, like, I have sensory processing issues, and so the thickness of this leather, and it's really tough, so I don't particularly like wearing them, but that's just me. So again, with my these shoes, I did more of what's called like a milled leather, or like a softened leather. So it's still the veg tan, but it has much more flexibility and give. And I thought that was more appropriate for my everyday shoe. You can see the creasing in them. I squat a lot, I bend a lot at work, so the boots are not really comfortable for that. They're fine for just, going to and from in the car, but learning the different types of leather, the styles, and then, like you said, doing inserts or not. When I swapped these tops, I just had a lot more flexibility in them. So I did end up ordering a piece of wool and then making kind of like a wool insert to take up some space in the shoe. And that works for cushioning and warmth, and just makes the fit a little bit better. So I think that was the hardest part, is knowing kind of what to expect. I like to wear socks, so having a little bit more forethought in, do I need more room for socks? Do I need more room for an insert? And then planning that into your construction. I don't think I had that forethought with the boots, so that made it more difficult, I think, the planning.
Yeah, because yeah, exactly. We don't know what to expect when you are doing it for the first
For
time.
the
Yeah,
first
I,
time.
I
Yeah.
understand. But maybe this is also with other types of shoes when somebody starts with different type. So maybe the issues can be a bit similar. Yeah,
Yeah.
and as you said, for the uppers, also mechanically softened leather is usable. So yeah, of course, when you know that, you can use also a softer leather. Okay, I see that a few people are watching us here. So if you have any questions or whatever, you can write us in the comment. And of course, if you are watching from the recording, you can still comment and we will answer. And Jenny, is there something we missed or something important you want to add or sum up the topic we discussed?
I think that, whether you're having pelvic floor dysfunction or not, foot health is super important. And I think, like I said, pretty much everyone can benefit from a wide toe box shoe. I think the other variables are person dependent and, what's your medical history? Have you had a history of arthritis or foot sprains or whatever? There, it's complex, but I think for everyone, having a good toe splay, being able to grip the ground, it helps with our balance. And we just know what that does longevity wise, right? Like the research shows if I can balance on one leg for longer than 10 seconds, I'm at a decreased risk of falls. So whether someone is just starting out or maybe rethinking their shoe wear later in life, there are benefits. So getting guidance with that. And some people might not share that opinion, and that's okay, but you just have to do what's best for you. And if you are thinking about making your own shoes, I would say absolutely go for it, because there is nothing like having a shoe that is perfectly made for your foot and you're walking, and to have that level of comfort is just perfection. And the happier your feet are, probably the happier your pelvic floor. So that would be my takeaway. What would you say? Anything
Okay.
else in terms of making your shoes?
Yeah, okay. So yeah, I think the that you told like the basis very well, and we have a comment here. I will just show this. This all very helpful and interesting. I wasn't aware of the direct link between the feet and the pelvic floor, and of course, it's so obvious. Yeah, thank you, Julie, for a great comment. Yeah, in the body, everything is linked. You just cannot treat the issues separately. Yeah, that
Right.
usually the medicine does. Yeah, but we have to think about all the body, the complex. So everything is connected, and the feet are the basis. So feet are basically connected with all the overall health, with everything. You agree,
Yeah.
Jed?
I do. And like
Okay.
you said, the foot's where we hit the ground, and then those forces go up through the pelvis, and then we have to figure it out from there. So, the happier our feet can be, the better. And it's kind of obvious once you point it out, but most people just really aren't thinking that way, right? And so that's why it's up to people like us to hopefully spread the news and get people thinking about it.
Yeah, yeah. So thank God we have people that are thinking more complex, like in the complexity of the body. So great. And thank you very much, Jen, for your time and for your very interesting and I think very useful explanations of the connections. And if anybody then has questions later when you are watching the recording, you can just write, and I will write your questions to Jen so she can answer. So thank you very much, Jen. Have a
Thank
nice
you so much
day.
for having me.
Yeah, and thank you everybody who are watching us. So have a nice day.
You as well.